The Pope will remain in the hospital as doctors continue to treat his double pneumonia.
And many of our viewers are asking questions, not only about the disease, but how it's being treated. So Dr. Pio Coley is here to answer some of our questions. Let's start with what is double pneumonia and how is it diagnosed?
So a double pneumonia is exactly how it sounds. It's a pneumonia or an infection or inflammation in both the lungs. And the idea here is the reason that it can be so much more dangerous is because when you have pneumonia in your lungs, they're filled up with fluid, with inflammatory cells, with pus, essentially, and you can't really use that part of your lung. So you can imagine if both lungs are involved, that really limits the reserve that you have, especially as you get older. And in the Pope's case, they diagnosed it with a CT scan. Sometimes if it's bad enough, you can actually see it just on a chest x-ray.
They have said that his treatment is very complex. Why is it so tough?
Yeah, so it's been interesting. He's failed home treatment, so they probably gave him something oral at home. He seemed to get worse, had more shortness of breath, more fatigue, more phlegm, and so they ended up admitting him to the hospital. And even in the hospital, they changed his treatment twice. And so they sort of see how you're responding and then decide basically what to do based on that. But in his particular case, they have him on steroids, which turns off the immune response because that itself can create damage in the lungs because, you know, whatever infection you have triggers the immune system and that causes damage. And they have him on antibiotics as well. As far as I know from the press release, they don't have him on any antivirals. So this appears to be a bacterial pneumonia.
We also know that this is polymicrobial. So can you explain what that means and what that means for treatment too?
Poly, many, microbial, microbes or organisms. So 2 or more bacteria, viruses, or fungus organisms. And that makes it again more tricky because it's not just one bacterial infection, it's multiple. And the Pope has an underlying condition called bronchiectasis, where you get scarring and widening of the airways, and that causes these mucus plugs to form. So that allows bacteria to sort of colonize your lungs, which means you can have more types of resistant bacteria that live in the lungs. And then one day if they wake up and sort of overgrow, that's how you can get a polymicrobial pneumonia. So polymicrobial pneumonia is usually harder to treat, usually requires multiple antibiotics to cover different organisms.
So the pontiff is older. He clearly has a history of problems. Now he has this double pneumonia. What concerns you about his hospitalization?
I think the biggest thing, Corey, is his age and the fact that it involves both his lungs. Now, the really good news is that it doesn't sound like he's on oxygen. It doesn't sound like he's had to be put on any kind of breathing support or anything like that. And the fact that he's in the hospital, possibly getting IV antibiotics will hopefully help him to clear it. But having underlying lung conditions like bronchiectasis, he also has a little bit of what's called asthmatic bronchitis, where the inflammation in the lungs triggers spasm of the airways, and that can cause a little asthma type of problem. All of that put together concerns me because at 88, we have very little lung reserve. And then if you get this kind of an infection, it can be significant.
Yeah. Thank you so much, Dr. Coley.